Hi, everyone. Thank you so much for joining us today for the 5th Wellness Alliance for Total Children's Health of Denton County Summit. I'm Lauren Purvis, and I'm the Program Manager for the Child Wellness Team here at the Center for Children's Health. Please be aware that this session will be recorded and made available through website and social media links to inform and educate the public on this topic. At the end of today's summit, we'll have a facilitated discussion with our Center for Children's Health team, and you will be invited to unmute yourself to ask questions, or you can type your question in the chat box. Keep in mind that if you choose to participate in an identifiable way, you acknowledge that your image and/or name will be recorded and are authorizing the use of your information in the recording as described. You have no obligation to appear or speak in the recording, and you can turn off your video and participate under a different name should you wish to remain anonymous. The recording of today's summit is protected by copyright law and is not to be copied. If you feel comfortable doing so now, please turn on your video at this time. All right, so thank you so much to our elected officials for joining us today. I believe Judge Eads is on the call, but is there anyone else that we're missing today? If you could maybe say hello or put an emoji in the top. So we're honored to have you here with us today, Judge Eads. For today's agenda, Becky Hale, the Director of Child Evaluation for the Center for Children's Health, will kick us off with a Cook Children's commitment. And then the Honorable Andy Eads will provide our formal welcome. And after that, we'll hear about Cook Children's efforts to improve children's health in the region. And then we'll receive an overview of the Wellness Alliance for Total Children's Health of Denton County, or WATCH, to learn how we're improving children's health locally. And then a highlight of the day will be learning about the results from our most recent community health needs assessment and how Denton County children are doing in the following topics: healthy lifestyles, mental health, and parenting support. After the data presentation, we'll take a short break before the award presentation. And then after the presentation, we'll have a 15-minute facilitated discussion and then finish up the day with a call to action and closing remarks. So with that, I'd like to introduce Dr. Becky Hale. Becky serves as Director of Child Health Evaluation in the Center for Children's Health. Her team oversees the research aspect of our community health needs assessment, evaluation efforts for the programs and coalitions led by the center, and various reporting endeavors to both internal and external audiences. Becky has worked for Cook Children's for a little over 10 years and recently completed her doctorate in education, with her research identifying the overlap of community-based strategies addressing tooth decay, obesity, and asthma among children and their families.
Thank you, Lauren. Thank you all for being here today. Cook Children's is committed to serving children and families in our communities, and we are so excited to bring you the results from our most recent Community Health Needs Assessment. This assessment is one of the many ways that we fulfill our system's promise. Knowing that every child's life is sacred, it is the promise of Cook Children's to improve the health of every child through the prevention and treatment of illness, disease, and injury. In light of today's event and our needs assessment, I would like to thank the leadership of the Center for Children's Health, Chris Pettigo and Marilyn Napier. And I would also like to recognize the work of the Child Health Evaluation team in overseeing our needs assessment research process, as well as Linda Fulmer, Courtney Bernard, Lauren Purvis, and Elisa Quimby in the planning and coordination of our summit today. At this time, I will turn it over to Elisa, who will continue with our agenda.
Thank you, Becky. Can everyone hear me okay? Okay. So thank you, Becky. My name is Elisa Quimby. I'm the program coordinator of the Wellness Alliance for Total Children's Health of Denton County. Our first speaker, the Honorable Andy Eads, has served on the Denton County Commissioner's Court since 2007. On January 1st, 2019, he became county judge. Previously, he served Denton County as Commissioner for Precinct 4. He is focused on cutting taxes while at the same time addressing the increasing demands of one of the fastest growing counties in Texas. Judge Eads is a past chairman of the Regional Transportation Council, or RTC, for the DFW region. He has served on the council for more than 10 years. Civic leadership and actively fostering relationships with nonprofits in Denton County is one of Judge Eads' highest priorities. Judge Eads began his public service career in the town of Addison, where he researched and authored the book Addison, Texas, A Pictorial History. He is a native Texan and a fifth-generation resident of Denton County. He received his BBA from Howard Payne University and his Master of Public Administration from the University of North Texas. Welcome, Judge Eads.
Well, let me unmute there for just a second. Well, it's great to be with y'all this morning, and I'm excited to just give a few little opening comments. And the first thing I want to say on behalf of the 5 members of Commissioners Court and our over 900,000 residents across Denton County who may never meet you or know you or directly come into the services that y'all provide, I just want to say thank you. Thank you so much for helping others and for really working on our future generations. I think it's just a special calling that each of you are endeavoring. And I just want to just start out and say thank you. Y'all deserve a big pat on the back. Many times y'all are a not too visible, and that's what we're working on. We're working on visibility about the subject, aren't we? And so you are so behind the scenes, in the trenches, up close and personal with our kiddos. And I just really want to say thank you. I do. I just want to say thank you as just a beginning. And I'm excited that this is the 5th Denton County Child Health Summit. And, this journey began back in 2009 when Cook's Children conducted an assessment of the children's health here in Denton County. And, I'll tell y'all, we have a lot to say grace over, as my daddy would say, when you think about the number of people that live in our growing county. Denton County has more people than 4 states. So just think about that, more people than 4 states. And so that is a lot. If you think about another state and all their resources for their kids, well, think about Denton County. And we have more constituents than 4 states, and also the District of Columbia. So they want to be a state. So we'll call them 5 maybe aspirationally for them. But, back in 2011, community members across Denton County came together and created the Wellness Alliance for Total Children's Health, or the WATCH Coalition, as we call it. The coalition's focus is improving the health and wellness and well-being of children in Denton County, especially their mental health. And Denton County and WATCH have collaborated over the last 10 years to address total wellness for children and families. And in 2021 Children's Health Assessment and Planning Survey, more than half of the parents in the Cook Children's Service area identified mental health care as difficult or even impossible to obtain. Mental health care access and awareness are a priority for Denton County community leaders. I know it is a priority of our full Commissioners Court and all of our different nonprofit leaders. Awareness is critical, as many parents report not being familiar with the mental health services here in their community. And we just really want to commend WATCH on their advocacy and awareness issues and efforts. I'll tell you, talking about issues is the very first step, as we all know. And I'll tell you, the Commissioners Court passes lots of resolutions and proclamations to bring awareness to the situation with our large megaphone that we have through our different individual outlets, media outlets, and our own sphere of influence. And we're so glad to be able to partner with WATCH. Y'all's efforts include your annual My Feelings, are a work of art contest. We love that. Countywide proclamations, readings in May for Mental Health Awareness Month, including those here in our Denton County Commissioners Court. Vital community workshops specific to timely and relevant children's mental health topics. It's okay to say campaign engagement to increase conversations surrounding mental health, including billboards, awareness events, and social media communication. In Denton County, I promise we will continue to partner with WATCH through our ongoing service on the coalition and our work groups, promotion of mental health awareness and available community resources, collaboration in the authoring of the Community Health Improvement Plan with the mental health previously identified as a key opportunity for improvement. And I'll just say how blessed we are, each one of us, to be working in this realm, to be working in this area, because not everyone has the benefits of when they are pursuing their vocation to promote generational change. Now just think about that, generational change. If you can help a kid with their well-being, their total well-being, their physical health, and their mental health, you're creating generational change because you are helping that child as they grow into adulthood, helping them with a solid, firm footing on life. And hopefully they'll be able to be mentally prepared for all the challenges that life faces before. Life is more complicated now more than ever. I'm not talking about COVID. I'm just talking about complexities of life. It's a complicated society, lots of decisions. And I remember years ago hearing Reverend Jesse Jackson give a speech, and he talked about destinations in life. And he painted this wonderful picture, I'll always remember, about a ship leaving a harbor. And he said, when a ship leaves a harbor, like a child growing up, when a ship leaves a harbor, on a destination, on a worldwide journey, the smallest early shift in direction carried out through the journey has a completely destination than their original destination that they chose. And I remember hearing that about 20 years ago, and it resonated with me to this day, because that's what we're about. We're about helping those kids as they start that journey in life, stay the course and not get deviated off of the course. And I think that's just a great word picture that the Reverend painted. And, about 10 days ago, I spent the day with the sheriff at his office with some long meetings going over some important issues. And I said, well, he goes, what else do you have on your agenda? I said, well, I want to go spend some time in the jail. He said, what part do you want to see? I said, I want to see it all. I hadn't been over there in a while, and we were doing some remodeling and so forth, and I wanted to check that out, but I wanted to see the overall operation. And I tell you, as I went after cell after cell, hall after hall, I could tell you, and just by the little interaction I had with the inmates, but I can tell you mental health is such a priority, and that did not just, those issues that those inmates were dealing with did not happen overnight. And we all know that did not happen overnight. And I think, wow, if they had some really good care and concern early on, that they were heard early on, I could tell that some of those people wanted to be heard. And if they could be heard early on and those issues addressed, they probably wouldn't be in our Denton County jail and not living their best life. And so I just want to conclude by saying thank you so much. Thank you for what you do. You're answering a call to public service, and you're actually in the generational change business, and how rewarding that is for each and every one of us. So thank you for all you do, and continue the good work.
Thank you, Judge Eage. Thank you for caring. Thank you for being here, and thank you for your continued support.
Absolutely.
Up next, Becky will join us again to lead us into the data presentation.
All right. Thank you, Elisa. Yes, and thank you, Judge Eads. As we begin the data presentation, I will highlight what a collaborative process our assessment has been this time around. I'll share a quick overview of our assessment methodology, along with a few more specifics with our parent and community leader survey demographics. And then Blair Williams will present the results for Denton County. Next slide, please. I'd like to pause first and recognize our numerous supportive community and research partners. I would first like to thank all of you. I know many of you helped share information about our parent surveys with the families in Denton County and completed our community leader survey and even participated in an interview. So thank you for your support in this endeavor. Thank you also to Linda Fulmer, our CHNA administrator. A big thank you to our research vendors who provided their expertise in collecting the data, ETC Institute, MHMR of Tarrant County, UNT Health Science Center, School of Public Health, and the Center for Transforming Lives. I would also like to thank the many internal departments within Cook Children's who have been very supportive of our 2021 assessment journey. And then for this assessment, we brought together an external advisory committee made up of community partners representing all 8 counties within our service area. These partners met July 2020 through August of 2021. They shared their time and insight with us as we were finalizing our parent and community leader survey instruments. They also created awareness of the surveys during data collection, and some provided interviews. Again, we had representation from all 8 counties, and I would like to thank Dr. Matt Richardson for representing Denton County on this committee. We greatly appreciate his involvement and expertise. Next slide, please. We expanded our methodology for our 2021 Community Health Needs Assessment. We conducted a household survey of parents and caregivers of children 0 to 17 from all 8 counties within our service area. And it is really important to note that this parent caregiver survey provides us with information from the parent's perspective, which is really insightful. But we also know that's just one piece of the puzzle. And so for that reason, we collected some additional methods of data. We held face-to-face interviews with families experiencing homelessness or with an undocumented member. We held virtual focus groups with families to gain a deeper layer of understanding around the barriers to access to care, COVID-19, mental health, and some other more complex topics. We conducted a community leader survey and visited with more than 20 leaders for a more in-depth conversation around children's health issues in their particular community. And then finally, we reviewed local, state, and national data to fill in any gaps, to look at trends or benchmarks, or provide additional insights. So at this time, I'd like to play a short video just providing a brief overview of this methodology.
Maintaining good health for North Texas families is not always easy. Many families face obstacles such as poverty, discrimination, quality education, housing, and unsafe environments. Addressing these hurdles requires a community-wide approach with a shared goal: healthy children. Everything we do at Cook Children stems from the promise we've made to our communities to improve the health of every child through the prevention and treatment of illness, disease, and injury. One way we keep this promise is through our Community Health Needs Assessment. Every 3 years through this assessment, we hear from parents and community leaders throughout North Texas. The valuable data revealed in this assessment becomes a shared rallying cry for community partners who collaborate with us to prevent illness and injury to children. The Center for Children's Health leads the Community Health Needs Assessment research and outreach services for Cook Children's. The center works to prevent injuries and illness and improves access to services for asthma, child abuse and neglect prevention, healthy lifestyles, injury prevention, mental health, oral health, and parenting support. A key element within our Community Health Needs Assessment is the Community-Wide Children's Health Assessment and Planning Survey. This is a household survey of parents and caregivers of children newborn to 17 to assess their perspective about children's health across our communities. The survey asks questions about how various health issues affect their children and how easy or difficult it is to obtain medical care. We want to know the parents' perspective on children's health. This survey, available in English and Spanish, is administered to parents and caregivers through mail, phone, and email. Because we care about the perspective of all parents within our region, we send the survey to a random sample of 25,000 households within our 8-county service area. We also intentionally survey families experiencing homelessness and families with at least one undocumented member. We're able to survey enough parents to have a high level of confidence in our survey results. Parents and caregivers in each county also participate in virtual focus groups to give us a deeper layer of data. These focus groups allow us to further learn about the unique challenges parents face with accessing medical care and social services within our communities. In addition to the parent and caregiver perspective, we survey and interview leaders throughout the community regarding their views on children's health. Additional children's health data from national, state, and local public health and academic sources supplement the findings from parent and community leader surveys. We bring all this data together to share with communities across our region Together with community partners, we work through our various collaborations to determine the best avenues to address these complex issues. It takes all of us working together to clear a path to better health for all children in our communities.
All right, so we collected quite a bit of information this time around, and we would love to share additional details of our methodology efforts for those who might want to know a little bit more. So for this reason, we have created 9 separate FAQ type documents that outline many additional details of how we conducted our research. We'll place a link in the chat to our website where these documents can be downloaded. You may also reach out to us at any time through the email address chnafeedback@cookchildrens.org if you would like to know more in the future. I also wanted to share that while we have conducted our parent survey, which is also known as CHAP since 2009, we knew that due to COVID-19 and other variables, it was time to update our survey to better align our questions with the National Survey of Children's Health. And this helps us compare our results to the national and state results. And Blair will provide some of that later in our CHNA data presentation. We not only better aligned our parent survey questions to the National Survey of Children's Health, but we expanded our survey this time around from households with children 0 to 14 to newborn to 17 to help capture more information around the health needs of the teen population. Next slide, please. And then we also included 2 additional counties, now surveying an 8-county region. And because of these enhancements, it means that we just want to be mindful if or when we might compare data from different survey years. We can definitely still do some comparisons on some of the questions, but because of the additional data that we've collected this time around through the focus groups and interviews, we aren't necessarily focusing on data from previous survey years today. But we do recognize that community health work is complex, and we know that progress is being made daily. Our parent caregiver survey methodology included oversampling in counties with lower population and rating the results by zip code to ensure that geographic distribution of the survey sample is comparable to the actual distribution of the 8-county child population. The parent survey data was then expanded to match 2021 census estimates for the 1.2 million children under age 18 living in the 8-county service area. And we completed our target of collecting over a little of 1,000 surveys within Denton County. Next slide. Our community leader survey is not necessarily representative of the population, but we surveyed 306 leaders across the 8 counties, which is a really healthy sample size. And leaders selected one primary county in terms of answering the survey. And around 11% of respondents selected Denton as their primary county. Then we also asked what role they were involved in their community. They're allowed to select more than one role. And so the top 3 roles that were selected were the categories of health professional, social services nonprofit, and educator school official. And Blair will share some of these results in her presentation. Next slide. All right, so after Blair presents the results, Lauren will provide kind of a final wrap up of our data presentation. And so before she begins, I wanted to share a little bit more about Blair. Blair Williams is a child health evaluation analyst at our Cook Children's Center for Children's Health. For the past 15 years, her expertise and passion for public health has been focused mostly around child and family health. In previous roles, she served as a community health educator, advisor to healthcare and school administrators, developer of family-centered community wellness programs, and then a researcher of family wellness behaviors. Blair brings her experience, enthusiasm, and love for data to our community health needs assessments and evaluation efforts. And we're also excited for her because she will begin her Doctor of Public Health journey this summer at Johns Hopkins. So super excited to see what more she'll bring to the table with that. So at this time, I will turn it over to Blair.
All right, thank you, Becky. Yes, that is very exciting news, but I'm also extremely excited to be here and present these findings for you guys because such an engaged community, and even just the enthusiasm that Judge Eads had in his opening remarks. Such encouraging community engagement. So I'm so excited to present this to you, and we'll get started. So if you can go to that next slide. Excellent. Okay, so I will be presenting our main findings with you today for Denton County. And the focus of this presentation is going to be help for children and families. And I'll explain that HELP acronym here in just a moment. But in this presentation, not only will we identify community health needs in Denton County for children ages 0 to 17, but we'll also explore some equity gaps that we're seeing with those key metrics. So if you can go to the next slide. Thank you. So how do we help every child with their health needs? And that's really why we're all here today, right? We want to help every child in Denton County. And one of the things that Judge Eads said that really stuck with me was that concept of generational change. So that's something I'm going to try to connect throughout the presentation as well. But of course, as Becky mentioned, at Cook Children's, our promise is to improve the health of every child, not only in our 8-county service area, but also in each of the counties. So we definitely had that in mind when we had all the methodology updates this go around with our CHNA. You can go to the next slide. Thank you. So today's presentation is going to be focused on simple stats and stories that we've highlighted from our quantitative and qualitative findings. In Denton County, we had over 1,000 caregivers complete that caregiver survey. And when I use the term caregivers, that could be a parent, a step-parent, a grandparent, aunt, uncle, foster parent. I want to bring emphasis to that because throughout this presentation, the word parent and caregiver might be used about the same time, but that caregiver term does refer to a diverse group of caregivers for children ages 0 to 17. Another point I'd like to make, and this is a question we often get, is this survey only of Cook Children's patients? No, the survey is given to a population of children across the 8-county service area. So this represents children in the community, not just Cook Children's patients. And another point of this is that the survey is designed to help point out needs around child's health, learning, and safety. And of course, we'll talk about that in today's presentation. But what's also a benefit of our survey is we're able to collect that representative sample and then use that sample to estimate a population number of children that have a specific health need. We're also able to compare some of our results with the National Survey of Children's Health, so we can see how our results not only compare at a national and state level, but we can also see how our results compare before and during the pandemic, which of course is top of mind for everyone. Another consideration is the National Survey of Children's Health data is used for national outcome measures and national performance measures, so we can actually see how all of our local area responses compare there. And by doing this, we're also able to identify community health needs and equity gaps. So throughout the presentation, I'll be highlighting some of those equity gaps. And when we talk about equity gaps, we're talking about children's race, ethnicity, their household income, age groupings, and we're also looking at caregiver type and some other metrics that we'll explore in the presentation. And there will be some times that I reference our Underserved caregiver survey, and that was done face-to-face with caregivers that had a child that was either at a homeless shelter at the time of the survey, or that family had at least one undocumented family member. So that gives us a great look into a population that may have more needs than the general population. And also, I'll be highlighting some key findings from our qualitative findings, and that includes the survey, the interviews with community leaders, with focus groups and caregiver interviews. And whenever I do refer to a quote or a story that I've heard through interviews, I don't provide identifying information or the county of where that person came from, because we want to protect their identity. And we're so thankful for their participation in our focus groups and interviews. We'll also pull from secondary data from time to time, which is from the US Census, National Survey of Children's Health, or CDC. Next slide. Okay. So from our 2021 CHNA, we identified the following health needs across not only Denton County, but our 8-county service area. So oral health, mental health, healthy lifestyles, parenting and family support, injury prevention, asthma, overall health, and equitable access to care. And at first, these topics may seem that they're categories rather than being intersected. But as we collect all this data and we hear from community members and we hear from caregivers in the community, we see that there is this concept of intersectionality between all of these health topics. And at the center of that is social determinants of health. So if you can go to the next slide, we'll explain that a little bit better, but I'm willing to bet most of the folks on this call know what social determinants of health is. But if it is a new concept for you, it's something that we refer to often in public health. And it's a concept that where a person lives ultimately determines their health outcomes. And for children, where they live, learn, and play has an impact on their health. And if I can refer back to Judge Eads in his opening remarks, that piece of generational change that really influences child health outcomes, not only when they're children, but as they become young adults, parents, and so forth. Next slide. So coming back to this concept of how do we help every child with their health needs? And as you can see, I've underlined HELP because we're going to use that as a framework for our HELP acronym. If you can go to the next slide. Thank you. So for today's presentation, we'll use the HELP acronym. This is a framework to help identify the community health needs for children in Denton County, also the equity gaps that I mentioned, and any supplementary information around mental health and how that connects with all the other health topics that I mentioned. We'll use this throughout each of, well, as categories for the whole presentation, but the HELP acronym stands for Health, Environment, Learning, and Parenting. So this allows us to look at this through the framework of not only health needs and the intersectionality of all these topics, but also the role of social determinants of health in overall child well-being. So health section would be equitable access to care and basic needs. Environment would be safety where children live, learn, and play. Learning would be readiness and support for academic success. And parenting would be parenting and family support. So again, today's presentation, as we're about to start, is a high-level overview of Denton County findings. It's not everything, and there's so much that is available. If you could check out our CHNA report when it becomes available. We also have a data dashboard that if you come to our C4CH website, you'll be able to access our data dashboard and interact with the data at a county level, income level, race and ethnicity level, many other crosstabs that may be of interest to you. And some of the findings that we cover today may be new to you, or they may be something you already know. It may validate and support your work. So if you're working on grants, or you need data to help bring more resources and attention to your health topic, I hope this would be helpful to you. And also the FAQ documents that Becky mentioned, those also have a lot of helpful information in them. All right, so let's go ahead and get started. If you can go to the next slide. Thank you. So for our first section of the HELP acronym, we're focused on health. Again, that's equitable access to care and basic needs. And the metrics that we'll look at in this section are health status, oral health status, mental health status, preventive care, if a child received all of their needed health care, and that includes medical, dental, and mental health services, and also their access to basic needs, so food, housing, stable housing, etc. Next slide. So if we look at health status overall first, okay, this is Denton County children. And according to what caregivers of children in Denton County told us, most children in Denton County have ideal health. And the way we define ideal health is there's a 5-point scale that parents could rate their child's health status, mental health status, and oral health status. And those 5 categories are excellent, very good, good, fair, and poor. So we define ideal as excellent, very good. 9 in 10 children have excellent or very good health status. 7 in 10 have excellent or very good mental health status. And 7 in 10 children have an excellent or very good oral health status. Now you will notice too that the age groupings change a little bit on that. So for health, we're looking at all ages. For mental health, we're looking at school age, which is 6 to 17. And for oral health, we're looking at children older than 1, because at that point they have teeth. And so we can look at that piece. Next slide. So we'll explore these each a little bit deeper and explore not only the health needs, but some of the equity gaps with each of those statuses. So again, most children in Denton County are healthy. And if you're wondering how that rate compares to the local rate, the 8-county rate, or US or national number, US or state numbers, this rate of children with ideal health is higher than our 8-county rate. And it is consistent with what we're seeing at the national and state level before and during the pandemic. And when I say before and during the pandemic for national data, before was collected in 2019 and during was collected in year 2020. So we can see that Denton County children, the rate of ideal health is higher than national and state. Now, if we explore the needs and gaps with the health status of children in Denton County, we see that there's over 20,000 children that don't have that ideal health status. And when I look at that a little bit deeper by race, ethnicity, and by income, and all those crosstabs that I mentioned before, I saw that ideal health status rate was lowest in Asian children in Denton County. And when we compare that to other race and ethnicity categories, we also saw that Asian children were less likely to have a preventive well child visit, less likely to have continuous health insurance coverage, and less likely to have familiarity with community health services. And then if we look at this by age group, we saw that the children who are 12 to 17 actually had a lower ideal health status compared to children that were 0 or 5 years or 6 to 11. And they were more likely to miss 4 or more days of school because of illness. They were less likely to have preventive well child visit and less likely to have received all of their needed health care. So from those metrics, we can see the importance of access to care for special populations. We could also see the importance of insurance coverage and that well child visit and how that plays an overall role in their health status. Next slide. So the next is overall mental health status, and this is of caregivers of children ages 6 to 17 in Denton County. So according to caregivers, 7 in 10 children have excellent or very good mental health. And this is a new metric that we've added to our parent survey. And so we'll monitor it to see what we find over the next couple of years, since this is top of mind with the pandemic and so many other factors. So if we explore this gap a little bit further, we see that there's over 41,000 children that don't have the ideal mental health status. And it's lowest among Asian children. And then it's also lowest in that 12 to 17 age group. So if I compare 6 to 11 to 12 to 17-year-olds, we're finding that those older children, those 12 to 17-year-olds, they're more likely to miss school because of a mental, emotional concern. They're more likely to have a caregiver who's very concerned about the COVID-19 pandemic on their child's mental health. They have the same level of familiarity with community mental health services, but they had more difficulty getting treatment or counseling for mental health. And they're less likely to not receive all needed mental health care. So again, access to care playing a large role in that mental health status. Next slide. So for oral health, if we explore that a little bit further, again, this is ages 1 to 17. Caregivers told us that 7 in 10 children have excellent or very good oral health. And this trend is slightly higher than what we see at the 8-county level, but it is consistent with what we're seeing at national and state benchmarks before the during the pandemic. And this, again, this is a new feature to our caregiver survey. So we'll monitor over time to see how this trends. So this is an estimated 47,000 children that don't have the ideal oral health status. Again, we see it lowest among Asian children in Denton County, but we also see it different here because we're seeing that if we compare 0 to 5, 6 to 11, and 12 to 17, actually all school-age children are less likely to have that ideal health. They're more likely to miss school because of dental pain. They're less likely to have familiarity with dental services available in the community, receive preventive care, or not able to receive all of their needed dental care. And part of that is because of COVID. A lot of dental offices were closed, and so they weren't able to get the dental care they needed. So this will be a metric that we monitor over time with additional surveys. Next slide. If we look at some factors that impact overall health and well-being, there's a metric that we like to use, and it's the rate of foregone care, or did that child receive all of their needed health care? And in Denton County, 3 in 4 children have received all of their needed health care. And while this rate is consistent with what we're seeing at the local 8-county rate, it is much lower than what the national and state benchmarks are from before and during the pandemic. And this is something we saw across our 8-county service area, all the counties, is that that rate of foregone care is so much higher here locally than it is at the national and state level, even before and during the pandemic. And given that the importance of access to care helps support overall health, it's also an opportunity for parents and children to connect with the healthcare provider, ask questions about child well-being, get additional support that they need at the home. So, thinking about all the children that did not receive their care and the impact it has on their overall health. And so in Denton County, that's over 50,000 children that in the last year didn't receive all of their needed health care. And when we had a follow-up question on the survey to ask why they didn't, the top reason, of course, was the COVID-19 pandemic. Insurance was not sufficient to cover the cost of care, or services weren't available in that child's area. We'll explore that a little bit more with some of the qualitative findings in the next few slides. But when we think of what types of care did Denton County children not receive, most did not receive all of their needed dental care. That's over 26,000 children that did not receive their needed dental care. There's 21,000 that did not receive all needed medical care, and 9,000 that did not receive all needed mental health care. So if we can go to the next slide, we'll look at insurance and the role that plays as well. Perfect. So we could see that most children in Denton County have continuous health coverage, health insurance coverage. And we define this on the survey because we have a question where we're asking, was this child cover all 12 months? Did they have a gap in coverage, or did they not have insurance? And so when we're reporting continuous health insurance coverage, what we're saying is 9 in 10 children had coverage all 12 months. This rate is consistent with the local rate, and it's also consistent with US and Texas benchmarks before and during the pandemic. And while most children have insurance, we could explore why and how many didn't. So in Denton County, there's over 16,000 children that didn't have continuous health insurance in the past year. And when we followed up with why, 66% of those children had a caregiver with a change in employer or unemployment. They dropped it because it was unaffordable or inadequate, or they had problems with an application or renewal process. So that plays a role in child's access to care. But even those that are insured, what we were hearing from caregivers and community leaders during interviews is that they may have been insured, but it wasn't enough to cover all of the costs of care. Next slide. Another factor around barriers to receiving care, and this is what we've heard from parents in focus groups and also community leader interviews, is that there are a large number of families across our 8-county service area that have to drive over 40 miles to be able to get either to a provider for their child's care or to find a provider that accepts their insurance. And so when we think about that, that may require a caregiver to miss work. It may require a child to miss school. And if they need frequent appointments or a caregiver has multiple children, that makes it difficult for them to maintain that work and school schedule. And we even heard from a parent at a focus group that said the nurse and front office lady had both made remarks about how much school that the children had missed because of doctor's appointments. And the other factor that plays into this is children that have underserved families, like our homeless or undocumented families, they may be less likely to seek the care they need because they're afraid of being reported to a government official or agency. And so from that, they may not be getting all the care that they need, especially when it comes to that kind of early developmental screenings, mental health, parenting support, those types of features. And if we go to the next slide, thank you. We see that theme of social determinants of health, again, where people live, learn, and play, it's playing an impact on their overall health. And this stat here comes from our community leader survey, which, as Becky mentioned, went to over 300 community leaders across our 8-county service area. They come from different backgrounds in public health, healthcare, school, church, nonprofit organizations, you name it. We had a very diverse ecosystem of leaders that participated in the survey. Over 60% of those leaders felt that poverty and affordable housing were serious problems for children in their community. And following up with what leaders said in interviews, this distinction between the haves and the have-nots is a concept that I heard across the 8-county service area. And another concept that was coming up in many of the counties was that adequate or decent housing might be limited in some areas. And so either families are homeless, living in cars, having multifamilies in a small living quarters. Those are all presenting not only health concerns, but safety concerns for children. And that plays a large role in their overall health. Next slide. And from these findings from our parent and caregiver survey, we could explore these health equity gaps by income. And on our survey, we ask several categories of that household income. And for the purpose of today's presentation, just presenting it in 4 categories. So we're looking at below 50,000, 50 to 100,000, 100 to 150,000, and 150,000 or more. For the purpose of Denton County, let's look at children under or below 100K because the median household income with children in Denton County is just over 100,000. In Denton County, there's over 95,000 children that live in households below 100,000. And when we look at children in these income categories compared to higher income, we see that they're less likely to have ideal health status that we've covered, mental health status, oral health status, continuous health insurance coverage, receive all of their needed health care, have a normal BMI, have access to nutritious foods, or access to physical activity assets in the community, such as parks and sidewalks, rec centers, boys and girls clubs, etc. So we can see that income plays a large role in overall health, access to health, and access to basic needs. Next slide. So from that, of course, supported even further from what we heard from community leaders and parents, and the concern that the COVID pandemic played a large role in all of this and has disrupted access to healthcare, basic needs like food, housing. And another concept that came from community leaders that really explores this intersectionality of all these health topics was the connection of good oral health to good mental health. And so dentistry for kids is critically important. A good smile and good dental health is good mental health. You look good, feel good. That plays a large role in child self-esteem and their school attendance. And we also see this what they refer to as a snowball effect. So there's this sense of, get your child in outdoor activities, get them in sports, get them to participate. But if you have caregivers who are working 2 jobs or they can't afford to do all those types of activities, then they can't afford the proper nutrition or access to healthy foods, it creates a big snowball effect for children. And so at the root of that is social determinants of health, but we can see how this is all connected through all these different health topics. Next slide. So to conclude the health section of our HELP acronym, We do see that strong presence of social determinants of health. It's influencing not only health status, but it's also influencing access to care and basic needs. And so from best practices and secondary data to help support that is offering equitable access to preventive care and treatment, and also supporting that access to basic needs, such as stable housing and food. And while I presented a lot of needs in this section, I like to conclude each of these sections of the HELP acronym with a positive quote from community leaders, because I did hear a lot of positive things too during the interviews. And this one, the pandemic impacted basic needs and food, but our community really stepped up to the plate. Churches and programs help young kids with food and adults who may have lost their jobs. Proud of our community, and the community really came together. And there was that really strong sense of collaboration, recognizing the need, and organizations working together to resolve a lot of these equity gaps that I have mentioned. Next slide. So we'll move into the next category of our HELP acronym, and that again is environment. That's safety where children live, learn, and play. And for this section, we're looking focused on ER visit due to accidental injury, adverse childhood experiences or ACEs, and neighborhood and school safety. Next slide. First, we'll look at accidental injury. And we define this on our caregiver survey as, did this child receive emergency care for an accidental injury? Yes or no? And so of caregivers of children ages 0 to 17 in Denton County, we see that nearly 1 in 8 children received emergency care for an accidental injury. And that's an estimated 26,000 children. Now, when we look at the stat, this tells us that 2 things happened. There was an injury that occurred, and that child received emergency care. Now, there could have been children that were injured but did not receive emergency care. So this stat just lets us know how many were injured and got the care they needed. When we look at trends at the US and state level, we see that the leading causes of unintentional injury death vary by age group. For infants, there are more deaths associated with suffocation, primarily due to unsafe sleep environments. For children ages 1 to 4, more cases of drowning deaths. And for children 5 to 17, motor vehicle traffic accidents are the leading cause. Now, for young children under 5 and teenagers, we see poison and firearm injuries as leading causes of death. And from community leaders and what we heard from parents, parents had this sense of it's going to happen and it's going to happen quick. It's just a moment when you look away for a second, and that's when that injury happens. Whereas community leader interviews said, we need kids in car seats. We need life jackets. We need all that water safety available to kids to prevent any of those injuries associated with those. And then another common theme that we heard from leaders on interviews was that, especially during the early part of the pandemic, essential workers or parents that had to make a difficult decision and leave their children home alone, there may have been older siblings watching younger children, and that presents an opportunity for home injury. So again, these all connect with social determinants of health and family support. Next slide. Our next slide here is we're looking at ACEs, or adverse childhood experiences. And this is the first time that we've included this metric on our caregiver survey. And we look at 8 different metrics of home and neighborhood safety. And these 8 metrics align with the same questions on the National Survey of Children's Health. So we're able to compare Denton County and our local rate to the national and state levels. And so for children 0 to 17, according to caregivers, we see 1 in 8 children has 2 or more of the adverse childhood experiences. And I've mentioned ACEs a couple times, but if you're not familiar with what ACEs is, it's a term for adverse childhood experiences that are potentially traumatic, that happen in a child's life and could have an impact on their health as they become adults. This is something that if you're looking for more information, we could certainly point you in that direction. But if we're looking at the top ACEs in Denton County, we see that most children have a parent or guardian that was divorced or separated. And then the next two are children who lived with anyone that was mentally ill, suicidal, or depressed, or had a problem with drugs or alcohol. And those two that I just mentioned were at the highest concern for our community leaders, not only in interviews, but also in our community leader survey. So again, caregivers that potentially are mentally ill, suicidal, depressed, or have a problem with drugs and alcohol. And that next leading ACE in Denton County is a parent or guardian that served time in jail or discrimination for a child's race and ethnicity. The others that I haven't listed here are around home and neighborhood violence or caregiver death, but those are less than 3% of children that have experienced that. And since this is on the national survey, again, how does Denton County compare to the US and state level? We see that this rate is lower than the national and state from before and during the pandemic. But one of the things that caregivers and leaders all agreed was that the COVID pandemic itself is an ACE, and it was so disruptive. So we could look at the effects of that when we explore mental health a little bit more. But it is important to note that here. And another leader said that this concept of ACEs really ties into youth risk behavior, substance abuse, mental health. This is all connected. And others told us that children who may be experiencing these adversities at home may be coming to the classroom or in the community showing up with signs of stress or depression and by fighting or acting out. And that really speaks to, again, what Judge Eads mentioned in his opening remarks, is that generational change and how so many that were in prison or were talking about their mental health and wanting to be heard. So when he said that, I'm immediately thinking of this data and how that connects. Next slide. Okay, so if we explore this concept of child safety by income level, we see that Denton County children in households with an annual family income below $50,000 may have the greatest safety needs. So again, we're looking at children in $50K annual household income compared to the higher income salaries. And we see that they're more likely to have at least 2 ACEs. They're less likely to feel safe in their neighborhood or school. They're less likely to feel be within reach of an adult during bath time, which of course increases that risk of accidental drowning. They're less likely to place their baby to sleep in his or own crib, which increases that risk of unsafe sleep environment. And they're less likely to safely store a firearm in a locked area, which increases that risk of a firearm injury for young or teenagers. And from our community leaders to help supplement this, of course, COVID was a source of disruption. And if children are living in unstable living environments because of a caregiver's job loss or housing instability, that causes a large stress on children. And it also poses a potential safety risk, because that crowded housing or unsafe or unstable environment not only poses a risk for ACEs, but it poses a risk for accidental injury to occur. Next slide. So with our HELP acronym, of course, we just completed this environment section. We do see that constant theme of social determinants of health and how that plays a large role in child safety. But from best practices, we could see that equitable access to emergency care and injury prevention resources like life jackets, gun safes, poison lock boxes, car seats, those all help prevent injuries. Also, access to safe, stable housing and food, and parenting and family support around adversities and helping them with their basic needs. Next slide. Okay, so next section of our HELP acronym is L, and L stands for learning, and that's focused around the readiness and support for academic success. We have some metrics here that we're looking at. And again, this is going to be age specific. So for school readiness, we're looking at ages 3 to 5. For developmental delay and learning disability, we're looking at children 3 to 17. And for mental health, diagnosis of anxiety, ADHD, depression, we're looking at ages 6 to 17. And for coping skills, resiliency and self-regulation, we're looking at ages 6 to 17. Next slide. So first we'll look at school readiness. And here we're looking at Denton County children ages 3 to 5. And based on what caregivers told us about their confidence level of their child's readiness for school, 7 in 10 children in Denton County are developmentally ready for school based on their caregiver's perception of growth and skills. So this rate, when we look at our local level and the national and state, we see that this Denton County rate is similar to what we're seeing locally, but our 8 county and Denton rate of schools, children that are ready for school is lower than what we're seeing at the national and state benchmarks from before the pandemic. For ages 3 to 5, this is just over 11,000 children that may not have school readiness based on that caregiver confidence. And we see that by race and ethnicity, the rate of children who may not be school ready are highest among Hispanic children, or by income is those incomes below 100,000. Of course, COVID plays a large role in this. The concern that we heard from parents and community leaders is that these young children didn't have the opportunity to be in a classroom where they had the normal classroom structure or social opportunities. And so that has played a large role in their learning development. And with COVID, it became really difficult for parents to understand where their child was with reaching milestones because they didn't have those opportunities to compare with other children. So again, this connects with that access to care for developmental screenings and also family support to help with that awareness of caregivers to know what to look for or what to seek out if they need services. Next slide. The next metrics that we'll look at are focused on developmental delay and learning disability. These are for children ages 3 to 17 in Denton County. And this is based on what caregivers told us a healthcare provider or an educator told them. So in Denton County, 9 in 10 children do not have a developmental delay, and 8 in 10 children do have a learning disability. Again, this is based on what caregivers told us that either a healthcare provider or an educator told them. And when we look at these rates compared to national and state, we see that they're both higher than what we're seeing at the national and state before the pandemic. So that's good. And now if we look at the needs and gaps, we see that there's about 16,000 children that have a developmental delay. By race and ethnicity, this is highest among Black children. And by income, we see that it's highest in incomes 50K to 150K. And this is unique because we've seen a lot of disparities in that under 50K or 100K category. But here we're in the middle range where that diagnosis or being told is higher. And for learning disability, we're seeing that over 20,000 children have a learning disability. Again, highest for race and ethnicity among Black children. And here it's highest in incomes below 100K.
Again, Blair, can I interrupt you for just a second? When you said that stat earlier, the 8 in 10 children you said do have a learning disability, but do not.
Right. Do not. Yes, thank you. So a part of this too is kids struggling with their emotions and parents having an awareness of what's normal and what they should be seeking help for. So again, that connects to the access to care, developmental screening, and family support. Next slide. Okay, so next we're going to look at mental health conditions. This is based on what caregivers told us that a healthcare provider provided a diagnosis of, and this is for children ages 6 to 17 in Denton County. So 7 in 10 children that are ages 6 to 17 do not have one of the most commonly diagnosed mental health conditions. Those most common diagnosed mental health conditions are anxiety, ADHD, behavioral or conduct problems, and depression. And not only are those the most commonly diagnosed in Denton County, but they're the most commonly diagnosed locally, the national and state level. But that 7 in 10 stat, that means 3 in 10 children do. And that means that's over 44,000 school-age children that have at least one of those conditions I mentioned. And if we look at it by race and ethnicity, we see this highest among white children. By income, we see it highest in incomes below 100K. By age group, we see it highest in the older child group, which is ages 12 to 17. And we also see it highest among children with 2 to 8 ACEs. This really speaks to not only the overall health, access to care, and some of the other disparities that we saw with that 12 to 17 age group, but the other element is the pandemic and the role this has played on mental health, access to mental health, the increase that we've seen in suicide or self-harm cases. And from community leaders, they recognize that, and we're focused more on suicide prevention, improving access to food and basic needs, and that youth resiliency piece. So helping children with their coping skills and any level of support to help with their mental health. Next slide. Okay, so if we want to look at anxiety, ADHD, behavioral conduct problems, or depression, for Denton County children ages 6 to 17 compared to Texas and US levels before the pandemic, we see that those estimated rates are higher for Denton County children. Now, again, this is all based on what caregivers have told us, so it's not cross-referenced with medical records. So this is a reflection of the percentage of children that that caregivers told us they have these conditions. Another concern is if a child doesn't have access to healthcare or going to regular well child visits, parent awareness is lower around mental health, there could be a large number of children that have undiagnosed mental health conditions, and so those wouldn't be reported here. But from this chart, we can see that Denton County children who are school-aged have higher rates of anxiety, ADHD, behavioral conduct problems, and depression. Next slide. And so while we talked about the needs around mental health, we could focus on some of the protective factors of coping skills and the role that plays in overall child mental health. This is a set of questions that is not only on our caregiver survey, but it's on a national and state survey, so we can compare the results locally compared to those before and during the pandemic. And we see that most Denton County children that are school-aged have 2 or more coping skills that can demonstrate resiliency and self-regulation. And these are all helpful as protective factors, especially in the case of a COVID-19 pandemic. And we factored that by, there's a series of questions on the survey focused on those coping skills. And they're showing interest or curiosity in new things, working to finish tasks that he or she starts, staying calm and in control when faced with the challenge. And so looking at those, they would have to have all 3 as always or usually in order to be considered coping very well. But to make it simple here, we're saying that most children have 2 or more coping skills that help them. And if we look at the US and Denton County, the top 2 bars are from the United States estimates. We have pre-pandemic and during the pandemic. We see that rate of children that have 3 or more coping skills did drop at the national level from before and during the pandemic. And while we don't have that baseline for Denton County, we do see that it's still higher than what we're seeing at the national level. So in other words, if you look at Denton County's estimate, 62% of school-age children have 3 or more coping skills that can help them with resiliency and self-regulation. Next slide. Access to child mental health in Denton County. Of course, if they don't have access to developmental screenings or behavioral health, that could play a large role in getting diagnosed or getting the care they need. Other factors that can impact child learning, development, and behavioral health include the pandemic, undiagnosed mental health conditions, presence of ACEs, social determinants of health, and again, that concern that a caregiver may not seek out care or resources for concern of being reported or deported. And when we explore needs and gaps around access to mental health care in Denton County, we see that of the children who needed mental health care, over half experienced difficulty getting that care. Nearly 8,000 children did not receive all of their needed mental health care. And while this was primarily due to the pandemic, they also cited inadequate insurance as a reason. And 2 in 3 children have a caregiver who is not familiar with mental health services in their community. So all of those play a large role in children getting the diagnosis and treatment that they need. Next slide. Now, if we look at how mental health and healthy lifestyles come together and intersect, we see that those school-age children that have one of those commonly diagnosed mental health conditions that I mentioned, again, anxiety, ADHD, behavioral conduct problems, or depression, when compared to children that didn't have that diagnosed condition, they were less likely to meet all of the following recommendations: nutrition, screen time, physical activity, sleep, and dental hygiene. So now the question is what comes first? Are they not getting these things and that's contributing to their mental health? Or because of their mental health, they're not pursuing all these wellness behaviors? But one of the things that we heard from community leaders across the 8-county service area is the presence of social media, excessive screen time, bullying, cyberbullying. All of that is so much more complex than it has been in previous years, and that certainly plays a role in child mental health. And if they're on the screen all the time, they're certainly not getting outside and getting their physical activity, and that's more of an opportunity for them to be bullied online or through social media. So outdoor activities or the presence of them could actually serve as a great protective factor for child mental health. Next slide. So as we wrap up this learning section, we see that social determinants of health, again, plays a large role in child readiness to learn, academic success, and even their mental health. And from best practices and what we've seen in secondary data, equitable access to developmental screenings and mental health services would certainly help. Again, safe, stable housing and food, parenting and family support, and resources for coping, resiliency, and suicide prevention could serve as protective factors. One of the key themes that popped up from the community leader interviews was that schools really stepped up and recognized the importance of social determinants of health in helping children come to school feeling safe and ready to learn. And so this particular leader interview said that they had a social worker on each campus to really help increase those types of services to children that needed it. And we want to be sure that they are provided with all of the existing community resources. So again, a lot of positive collaboration around these health topics because they are so large and definitely need a lot of people at the table to address. Next slide. Okay. So we're in the parenting section. And in this is our final section of the HELP acronym. So we're focused on parenting and family support in this section. We're looking at caregiver coping with parenting demands. Caregiver have a source of emotional support. Does that family have access to nutritious food and physical activity? BMI for age is another consideration. But again, when I'm using the term parent and caregiver, those are the same things, and caregivers could be parents, step parents, grandparents, foster parents, etc. Next slide. So we'll take a first look at parent coping. If you go back one slide, I think. There is. Okay, perfect. Thank you. So if we take a look at parent coping, this is a metric that we have on our caregiver survey. It's a 4-point Likert scale of very well, somewhat well, not very well, and not very well at all. Here we're looking at the percentage of children that have a caregiver who is coping very well with day-to-day demands of raising children. And at this CHNA finding, we see that over half of children, of Denton County children, have a caregiver who's coping very well. Now, if we look at this rate compared to what we're seeing at the local level and national and state, we see that across all of those geographies that trend of coping very well is declining since 2015. So at first thought, we could say, well, of course, the pandemic has been a huge stressor for parents. But what we have seen across, again, all those geographies is that rate of coping very well is decreasing since 2015. And then thinking back to what we heard from parents and leaders in the previous sections, we see that there's a lot of factors that could be contributing to this decline. In Denton County, there's over 100,000 children that have a caregiver who is not coping very well. And if we look at these by crosstabs, we see by age group, it's the rate of parents not coping very well is highest if children ages 12 to 17. By income, it's highest in incomes below 100K. We see this rate of not coping very well highest among caregivers who are grandparents. And also by condition, the children that I had mentioned that have anxiety, depression, ADHD, or behavioral conduct problem, we see that this rate of parent coping very well is, the rate of not coping very well is highest among children with a mental health condition. So that certainly puts a stress on a family. And if we look at this by ACEs, we also see that rate of not coping very well is highest among children with 2 to 8 ACEs. So adding the COVID pandemic and all the stresses that have come with it, that just exacerbates some underlying stressors in the household. And that just really speaks to the importance of addressing social determinants of health when providing parenting and family support. Next slide. The next metric we look at is emotional support for parenting. And here we ask, do you have an emotional support for parenting? And they could say yes or no. So for Denton County, 85% of children have a caregiver who has a source of emotional support. So when we had a follow-up question on that survey, where did they get the support from? We heard that they most commonly got it from other family members or a close friend, a spouse or domestic partner, a place of worship or a religious leader, a healthcare provider, or a peer support group. And it's important to really highlight those because those all serve as protective factors and resilience factors for families. And so addressing that and engaging with those sources of support will help parents and children. And this rate, when compared to national and state, we see that this rate of caregivers who have emotional support is higher than what we're seeing at the national and state level from before and during the pandemic. But there's over 31,000 children in Denton County who do not, who have a caregiver who does not have an emotional support. And for single parents or single caregivers, they may not have that source of emotional support. And this parent from a focus group said that they're finding support from church group meetings, and that's where she gets their support. And then others that are single parents are saying they're exhausted and they have to work all day, but then come home and be engaging parents. And so it just requires a lot of effort and energy, which if there's a lot of other stressors in the home could be difficult. And if we think about how this all connects to mental health and ACEs, those two top ACEs that we saw, if a caregiver or if a child's living with somebody who's got a mental health illness or drug and alcohol use, that could be a source of ACEs for children. So this really speaks to the importance of having emotional support and parenting and family supports to help mitigate those concerns. Next slide. If we look at awareness of resources in Denton County, these are community resources. We're primarily focused on healthcare resources, mental health resources, dental services, and 211 hotline. We asked caregivers their level of familiarity with these resources in their community. So in Denton County, the caregivers have a higher awareness of dental services, but they have lower awareness of mental health services and that 211 hotline. Mental health services, of course, improves access to the care they need, but that 211 hotline is also a great resource for families if they need help getting connected with food banks or food services or housing, job support, any kind of help get connected to community resources. So that's lower compared to the awareness of dental services. Next slide. So we've covered a lot in this parenting section, but as you could see, it really touches on all the previous sections. And we could see that, again, that present theme of social determinants of health in the role of parenting and family support. So from what we're seeing in best practices and secondary data, the awareness of parenting and family support resources in the community would be helpful. Equitable access to healthy food and physical activity so that children are detached from screen time and more physically active outside or in sporting activities. The last piece is equitable access to family-centered care for preventive care, for health education around nutrition, mental health, dental needs, and then of course assistance with basic and social needs if they needed it. And again, the positive quote in all of this is that there are organizations who are pulling resources together. They see such a positive and uplifting thing from this. And this particular leader said that while trying to find unique services for families in need, they uncovered a lot of awareness around resources available in their community. And so from that knowledge, they were able to help more families. So in a way of basically saying that collaboration and that desire to help is just fueling the ability to help other families. Next slide. All right, so we covered a lot, and I know that there's so much that we covered, and this was probably very intense. But the good news is we have this data available in our CHNA report. So when that comes available, you could see this and so much more. If there are metrics that we did not cover today that you're interested in, I encourage you to go to our data dashboard where you can look at Denton County stats by different crosstabs. And you could also reach out to us if you have any questions about the data that was presented, or if you had any additional questions. But to kind of close out this piece is that all of these health topics and all these health needs that we identified in our 2021 CHNA, they're all intersected, and at the core of it are social determinants of health, and that's where children live, learn, and play. And if we focus on that HELP acronym, that helps identify areas where children need improved access to care or support services in their communities. So thank you for the opportunity to present to you today. It's so encouraging to see that collaboration in Denton County, and I look forward to seeing what the discussion holds this afternoon.
All right, thank you, Blair. I've said it probably in every other summit, and I'll say it again, I'm still always amazed at how you're able to put all of this together for all of our participants to be able to easily digest everything. So we definitely appreciate you. But we've been so excited to share all of this information with you all. And so I hope that Blair has given you some new or at least validating insights to think about. But before our break, I'd like to recap just a few key points from Blair's presentation, and you'll see them here on the slide. So for children's health needs, they need more preventive care for health education, community resources, and social support to children or to support child health and well-being. And then for children's environmental needs, they need safe and stable and nurturing environments to reduce the risk of physical or emotional harm. And then for children's learning needs in Denton County, more of that preventive care, developmental screenings, behavioral health, or social services to support that academic success. And then for the needs of parents, addressing the social determinants of health like Blair touched on, such as the access to basic needs, healthcare, or safety, with that social and emotional support for families. So later in this session, we'll have some interactive dialogue where we can discuss this data and how to help children and families in Denton County. And so before we take a break, we're going to let you know what those discussion questions are. So you can, if you want, you could go ahead and start putting some of your answers or responses in the chat, and then we can bring those in during our discussion. Or if you need some more time to think about it, you're more than welcome to. But those discussion questions, so we have 3 for you all. The first one being, what surprised you most from the data presentation and why? The second one is, based on the children or families your organization serves, what types of community resources do families need the most? And are there collaboration opportunities for providing or sharing these resources? And then the last one being, what other organizations need to be at the table to improve children's health in our community? And so, like I said, if you want to go ahead and start putting your thoughts in the chat, you're more than welcome to, but we'll go ahead and take a 15-minute break. You can turn off your camera if you'd like, and we'll have I think a countdown timer so you'll know when to return. But thank you all, and we'll see you for the second half of our summit.
We'd now like to present a second video on what we do with that data and how important community coalitions and partnerships are to that entire process.
How do you improve the health of 1.2 million children spread across 8 counties? Well, it takes a lot of planning, a lot of collaboration, and it takes a lot of support from people like you. Every 3 years, the Center for Children's Health pulls together important data from the public through the Cook Children's Community Health Needs Assessment. That information helps us to build strategies to meet our region's most pressing needs through our programs and through our coalitions and community partners. We then work diligently to track our success. Are we all moving the needle like we want? Are we making a difference? This work is bold and big. Change at the community level often takes decades to fully integrate, but progress is being made daily through all our dedicated partners working together. We report on our progress annually to the government, state and federal, as well as to Cook Children's leadership and other internal departments. We also celebrate this progress with our collaborative partners and build on the collective wisdom our shared experience provides. Although we've always used data to drive our work, our first formal community health needs assessment in 2009 and the assessments that have followed validate the work we do through our collaborations and programs. Data also guides us on how and where we do our outreach. It's data-driven decision-making so that everyone benefits. As we review the most recent assessment data to create strategies for the next 3 years, we take into consideration what has changed in the communities. Are there changes in available resources? Are there new methods to address the needs? We also rely on our partners who live and work in each community to provide helpful context on key people and organizations to work with, approaches that have been successful, and where there are gaps we might help bridge. A few examples of how we utilize our assessment data include: determine new ways to support equitable access to care for all children, expand parent support educational topics, develop a program to identify and remove asthma triggers in the home, strengthen oral health messaging for pregnant women, promote a healthy lifestyle curriculum, including gardening basics for children. We then recommend revised strategies to Cook Children's leadership. Once approved, we have a roadmap for the work we will lead or support in our communities over the next 3 years. Every year, we coordinate progress reports that outline the incredible work our programs and collaborations are doing to improve the health of the 1.2 million children in our region. Gathering this information from families, leaders, and partners is a fundamental element in our efforts to help each child reach their full potential. The overall process is definitely an investment, one that will serve our community well for decades to come. Thank you for the part you play in improving the lives of children and families. Visit our website to learn more.
All right, given that information, it's my absolute pleasure to introduce the chair of the Watch Coalition, Joshua Marshall. Joshua Marshall is a licensed marriage and family therapist and chemical dependency counselor, and currently serves as the business development manager for Connections Wellness Group Denton. After graduating from Abilene Christian University with his master's in marriage and family therapy, he moved to Denton and began working in private practice and also with a local psych hospital before ultimately changing over to a business development role. It is his clinical foundation and systems theory that drives his desire and passion to be an integrated part of our local community. Thank you for joining us, Joshua.
Thank you, Elisa, and thank you everyone for being here. As Elisa said, my name is Joshua Marshall, and I am the chair of the Watch Coalition. I would like to take a moment to share some highlights of the work that the coalition has done in recent years. In 2011, the Wellness Alliance for Total Children's Health of Denton County formed in response to the first CHAPS survey results. In a nutshell, the coalition works to increase community awareness and promote children's mental health. We also developed a vision to guide our work. Because every child deserves hope, the Denton County community dedicates its unified resources to equip our children to reach their full potential mentally, physically, and socially to achieve their maximum personal success. The main goals that we employ to carry out that vision are: engage Denton County community to improve children's health, to sustain a strong network of quality mental health services to support families and children, to increase access to information and resources for children, parents, and community members, and to monitor children's health issues for Denton County children to allow for informed decision-making. And one of the ways we do this is through our wellness workshops. The Watch Coalition, through the work of the Watch Education Work Group, hosts wellness workshops throughout the year. These workshops provide quality continuing education credits based on evidence-based practices and gaps in knowledge in the community. The speakers are always local experts who understand the needs of Denton County kids. The audience for these workshops includes a member of professionals from nonprofit organizations, social service organizations, school districts, MHMR, public health, and other child and family serving organizations. Due to COVID, we worked together to pivot workshops to a virtual format, which resulted in a wider reach of participants nationally and internationally. Watch has hosted a total of 22 wellness workshops on various topics relating to children's mental health and providing approximately 2,000 hours of continuing education. Another way we do this is through our art contest. Watch also hosts an annual youth art contest and art gallery. The theme of the art contest is "My Feelings Are a Work of Art." Denton County school-aged children are encouraged to put their feelings on paper. All 18 libraries in Denton County have participated in the contest by serving as an artwork drop-off location. Coalition and community members collect and judge the artwork. Then the artwork is displayed at an art gallery where the artists, the artist families, and community members are encouraged to attend. In 2020, we received 247 submissions, the most entries in the history of our contest. This year, we have received over 100 submissions, and the art gallery will be held virtually on the Watch website from May 16th to 20th. Turning now to our efforts to engage the community and increase awareness about children's mental health, the coalition adopts a number of strategies. The Denton Behavioral Health Leadership Team and Watch Leadership Team have initiated bi-monthly touchpoint meetings to work more intentionally to improve children's health. We've seen great momentum with community initiatives through these meetings, including a concentrated effort to promote the OK to Say campaign. A collaboration between Watch, Connections Wellness Group, the United Way of Denton County, and the Behavioral Health Leadership Team resulted in an OK to Say billboard on I-35 in Denton. This billboard provided a new way to start conversations with families. Our billboard was up for 6 months, and to put this into perspective, the impression count for the billboard selected was 483,610 people per week, based on views by folks of the age 18 and older. Watch also plays a part in encouraging Denton County municipalities to resolve to make children's mental health a priority by designating a certain day each year as Children's Mental Health Awareness Day and participate in continued awareness efforts throughout the month of May. This year, with the support of our members and community partners, Watch is distributing flyers and yard signs throughout Denton County that say "Together for Mental Health," and we're encouraging everyone to go green in support of children's mental health. We'll also host a wellness workshop on May 6th, where we will take a look at building resiliency against adverse childhood experiences. Watch also strives to support the events of our partners. Coalition members often table community events and offer children's mental health educational materials to the community and community partners. Just a few examples of this are the Denton Dash, the various back-to-school fairs held by local districts, the Denton Independent School District Annual Resource Fair, and the Lost Team Race for Hope. Since the coalition's inception, we have distributed over 70,000 mental health improvement tools and educational resources. And finally, the coalition celebrated its 10-year anniversary last year. And this is a huge milestone and speaks to the dedication and commitment to the Denton County community, the dedication and commitment the dental health community has to improve children's health. It's amazing that we have maintained the ability to move initiatives forward and grow virtually. It truly speaks to the tenacity and hard work of the coalition. These accomplishments would not be possible without the wisdom, resiliency, and support of members, leadership, and partners of Watch. So please join me in thanking them for all they have accomplished. We are grateful for all the work these individuals have done, and every so often we get the opportunity to recognize one of those members for their hard work and dedication to improving children's health. At this time, I'd like to turn it over to Courtney Bernard to do just that.
Thank you, Joshua. And this is an extra special one here. And we're kind of mixing up the roles a little bit here. But yes, every once in a while, the Center for Children's Health wants to pause and reflect and make sure we are recognizing and thanking our partners who go above and beyond every day with us. And today we'd like to shine that spotlight on a partner with our Blue Peak Award. And this award is given to what we call healthcare heroes who have provided extraordinary support at the county level to advance the objectives of Healthy Children 2030. Those who have moved the coalition's work to the next level, and those who have provided multiple levels or years of support. And in Denton County, we believe that the Connections Wellness Group is deserving of this recognition. We heard Joshua share some of the highlights from the way the Watch Coalition has been able to partner with the Connections Wellness Group in recent years. And those are just some of the reasons why we thought they were deserving of this award right now. And today we have Austin Gregg here to receive the award, and of course, Joshua Marshall and BNA Reinhardt along with them who have just been right alongside us. So I'd like to first share more about the contributions that we've seen and appreciate from Connections Wellness Group. And so like you heard, they funded a billboard in partnership with the Watch Coalition, OK to Say, and the Denton County Behavioral Health Leadership Team to expand the coalition's reach of that mental health messaging. They have served on the Watch leadership team and subgroups. So that's, again, Joshua and BNA, who have served a combined 8 years in various leadership roles. And they also plan and facilitate several Watch wellness workshops. They help to establish those touchpoint meetings to increase collaborative efforts between the Watch leadership team and the Denton County Behavioral Health Leadership Team with their Child and Family Systems Work Group. So again, streamlining that collaboration and really make sure that all these different collaborative groups in the county are aligned in their strategies so you get the biggest impact possible. Connections Wellness Group has provided ongoing support for Children's Feelings Are a Work of Art, the youth art contest, by sharing and distributing resources, serving as those library liaisons to get the word out. and connect with families. They've served as judges and have participated in the art galleries. They make their rounds across the community, sharing children's mental health information, and continually assist with the Watch membership recruitment and coalition advocacy. So huge support all around from multiple people in many ways over many, many years. And we are just so grateful. We could not do this work without partners like Connections Wellness Group. And we're so glad to have you with us. So I'd like to first ask our Watch Coalition Coordinator, Elisa Quimby, to say a few words about why she nominated Connections Wellness Group.
Sure. Well, I'd love to. As Courtney mentioned, when we look at awarding the Blue Peak, we think of partners who have provided extraordinary support at the county level. And I mean, I think from everything you're hearing, it's clear that Connections Wellness Group has done that. We also look for someone who's moved the coalition's work to the next level. Connections Wellness Group has done that in many ways. And then finally, we look for someone who's provided multiple levels or multiple years of support. And Connections Wellness Group has done both of those. They've provided multiple levels of support and also multiple years of support. They've really been a key to the coalition's collaborative efforts, and they're honestly just a joy to work with. Connections Wellness Group is a wonderful group of people who are doing amazing things in the Denton County community. So they just seemed like a natural fit for this award.
Thank you, Elisa. Yes, absolutely. I'll also see if the Watch Coalition's Vice Chair, Kirsten Cram, would like to say a few words as well, as I know she works closely with them too.
Yes, thank you. I'm very honored to be able to speak on Connections Wellness Group. I've had the privilege of working with both VNA and Joshua, and I cannot think of a more deserving organization for this award. As stated, Connections Wellness has helped out with everything from the billboard to the art contest, and just I've been with the organization since 2019, and I have worked with VNA through that whole time, and then Joshua in the most recent years. And they are always there to help push the Watch organization along. And I know the Watch Coalition is comprised of many people throughout different groups and agencies and everything like that. But within Connections Wellness, I think Watch has grown so much more than it would without them. So I'm very honored that they got this award.
Thank you. And I hope everyone from Connections Wellness Group who is here with us today is looking at the comments in the chat box because they're just incredible. But Austin, I'll invite you to share a few words with us today. We're glad you're here to join us and share in this excitement.
Absolutely. And I just wanted to echo what I put in the chat. We're truly honored to be thought of in this way and to be honored in front of the peers like this. I know that we all serve a worthy cause each and every single day. And it's something so needed, and to have allies in that endeavor is a truly humbling thing. We have it right here. We'll add it in as a centerpiece in what we do, and we hope that it inspires others to continue in this worthy cause. So again, thank you so much for the honor and the designation. We're so happy here at Connections.
Thank you. Very much deserved, and we're glad you're here with us today. Well, with the smiles on our faces, we can transition into the last part of our agenda, and that is a discussion about the data and what it means to Denton County and all of you who are here with us to see how the data resonated with your experience with children and families in Denton County. So you see the group discussion questions on the slide here. We're actually going to start out with a poll to ask that first question. So if someone can pop that poll up for us. There we go. And so as you heard from Lauren, we want to hear from you. What surprised you most about the data presentation and why? And to help you narrow that down, we have that HELP acronym that Blair introduced to us that you can respond to. But please also feel free to put any comments or thoughts in the chat box if there's something specific, because we'd love to hear from you. And we may invite some of you to unmute and share more. While we wait for you all to respond with a poll, I'll turn it over to Blair, Elisa, and Lauren, who can get us started off with some initial thoughts as they first saw the data.
Well, I'll jump in. I'm silently watching the poll results live, and it gives me really great insights to what you're all thinking. But if you were to ask me what surprised me most from this health acronym, I think the tie-in of that, the role of environment to the overall health, learning, mental health, and even parenting support, I think that plays a large role. But I was also really surprised on some of the equity gaps that I saw. And so I was hoping that some folks can provide some community context to that in the discussion as well.
Absolutely. And I just shared the results. Hopefully you all can see them. But gosh, it's pretty spread across the board. What surprised you? So I'd love to hear from you. If you would like to share more about something that surprised you about the data, I'll invite you to put that in the chat, and then we can call on you to unmute. Elisa, any thoughts from you?
Yeah, I think, and there was a lot of really interesting data shared, but I think for me, the surprising thing was just how Denton County rates when it comes to awareness of community services. And that's probably just because, we're in the thick of it and I'm seeing all of the awareness. But for me, that was kind of just a little surprising.
Mm-hmm. And I know, sorry, Lauren, go ahead.
You're fine. I was going to say, from my perspective, I thought it was interesting how, and I don't know if vulnerable is the right word, but that 12 to 17 age group seemed to have a lot of those like difficult or access to difficulties or barriers to access to care and things like that. And so I feel like, some of our programs sometimes seem like they're more applicable to those younger kiddos. But this was really interesting to see that 12 to 17 age group really highlighted in that data.
Let's see. Oh, Courtney put in the chat. Thank you, Courtney. Let's see. It says, I was saddened that half had difficulty getting mental health care and that 8,000 children didn't receive their mental health care.
Mm-hmm.
Absolutely. So we know the need is high. There are resources in Denton County, but we know there's challenges and barriers to getting access to that care, whether at the family level or organization level. Lisa, yeah. Elliot, Blair, go ahead. Yeah.
Yeah, I often struggle with, I want to give you everything. Like I want to just data dump and just show you everything, but it's so hard to pick the data points that we should focus in a 40-minute presentation, right? And so adding ACEs was a new addition to our caregiver survey this go round, and of course we'll monitor it with every subsequent survey. We'll also be adding some additional ACEs metrics. So that one would be struggling with everyday needs. So we'll be adding that to our ACEs metric, and we'll also be adding if there was any discrimination for that child's sexual identity or gender. So we'll be able to look at that in coming years and be able to compare that at national and state levels too. So more to come on that, but I am glad that you found that ACEs data enjoyable and the coping information as well.
Mm-hmm. And I'll share, I had the, of course, we have to text throughout the presentation as we learn things and are excited and say, oh my goodness, that is so cool. But I heard some questions in the conversations I was having about wanting to dive deeper into the data to say, well, I wonder if this is still true for families who meet this criteria or this demographic, et cetera. And I think the data dashboard is a good place to kind of dive in and look at some of those crosstabs. Maxine talked about being surprised that families said they were coping well. So I wonder there if maybe it doesn't necessarily mean that things are hard, but maybe families feel they have the support or skills to get through the hard times, perhaps. Denton County has a lot of support where the community comes together. So I'd be curious to hear people's thoughts on that. And Marnie Stone, yes, your comment as well. We typically think of the families who are in low income situations and who struggle to access those services, but the reminder that higher income families struggle as well. Mm-hmm. This is incredible. Thank you for your comments in here. And Lisa, I'm going to hold on to your comment about the mental health navigators for one of these upcoming questions. So as we move forward to our second poll question, let's get this launched for you guys. We'd love to hear from you based on the children or families that your organization serves or is interested in. What types of community resources do families need the most?
I have a feeling I know how this poll is going to go.
And we see mental health navigators is on the list because that came out of the data.
Yes. Yes. Dr. Elliott is smiling.
Yes.
Lisa, would you like to speak to that at all while we wait for these poll results to come in?
I don't know if you really want me to, because you might get me on a soapbox.
Absolutely. We want to hear your soapbox. We know it's a good one.
This data was absolutely incredible. I've been involved with this now for all the number of years you've done this, and I feel like you guys have done a much deeper dive in so many critical areas. I am so impressed and so grateful for you. In fact, I'd already been texting me. I use some of this data in a presentation I've got to present soon. But the mental, this did nothing but support this issue that so many of us have been working on for years now. Laura and I had this as a mission, from 10 years ago, of creating a mental health navigator, which is an evidence-based program that is very effective at helping families navigate through challenges in accessing mental health care. And so I don't know how many people have actually had access or actually used the 211, but oftentimes their information is limited because they don't have the information. So this did nothing but fully support this, and I am just beside myself excited. I want to get the information to Judge Eads. That's all my comments.
Excellent, beautiful, yes. Thank you for that. And he was so supportive in his comments. He has been since we've known him all these years. So we're grateful that he's a champion for this work as well. I've shared the poll results. So of course, we see mental health navigators, lots of people responding there because navigating the system and accessing those resources is critical and is pretty hard. Where do you start and how do you go through? And that even speaks to Kathy's comment in the chat, I think, where we see some of the data that says families report that children don't have a developmental delay, but is that developmental screening happening at the rate they assume it is or needs to be? And so if you don't know that or don't know to ask for that, then where do you go from there? And so having somebody in your corner to help you get to that. And I know Maxine's group works in that realm as well. We see some folks saying that parent coping information is needed. I'm guessing you see that as a need in your organization. And then always access to basic needs such as housing and food and utilities. We're always going to have families who need that to get the basics. Any other thoughts or comments from Blair or Elisa or Lauren or anyone? Please feel free to put in the chat.
One thing I would say, and it's along the same lines of Kathy's comment, is when we look at our sample of our children that are either homeless or have an undocumented family member, in some of those metrics, they actually rated more favorably compared to the 8 county children. And I suspect that might be that part of that limitation was they were doing a face-to-face interview and were less likely to say, I think there's something developmentally wrong with my child, or I'm not coping well as a parent. So there are some limitations, but I see that even at the 8 county level for some of the metrics where lower income families their reporting of some of these things are a little bit different, which doesn't align with what we see across all the other health topics where there are disparities for children in low income households. So just to think about how that really complements what we heard from leaders, and that there are populations of children and families that are less likely to get care for mental health or developmental screening because of their income status or if they're undocumented.
Thank you, Blair. I'll ask a follow-up question related to this. So we know we've identified the resources family needs the most. So are there collaboration opportunities in Denton County community to share about those resources with one another, that networking and sharing of resources so that we can get families connected? And I'll add, I'll invite Elisa, our coordinator, to speak a little bit to this, because as you heard, the Watch Coalition works with all these other groups who are doing similar work. So we know they're out there. But I'll say, if anything that you guys put in the chat box, if you have a resource or a networking group or something that you know of, we'll be able to pull that and share that with everyone afterwards. So it can be another resource for all of you. So just know that we don't want to lose your comments. But Elisa, any thoughts there about those collaboration opportunities?
Yeah, I'll just share a couple off the top of my head. So the Watch Coalition really places a high priority on being able to share the different things that are going on in the community. And there's two key ways that members and community members alike are able to do that. So Watch has an internal communication called, I think it's called the Watch Out, which is our monthly member newsletter. And so members or partners can share announcements that can go in that newsletter, and then we'll share that with our coalition members, who in turn share that with those they're serving or their partners. And then another way to get community announcements out is Watch has specifically set aside time at each coalition meeting, about 15 minutes, for the community to make, or members to make community announcements during those meetings. So we can ask questions or bounce things off one of another.
Mm-hmm. Does anyone else know of groups, or do you host your own group where this happens and this kind of sharing occurs? Great, Maxine, thanks for putting this in the chat. Working with Alice families. I was about to say, can you spell out Alice families for us, Maxine? But you already did. Thank you. Asset limited, income constrained, employed. Oh, incredible. Yes, Denton County United Way has so many initiatives to support families, and I know they also bring people to the table for their work. So that, Maxine.
I just want to put in a quick pitch for Help Me Grow North Texas.
Please.
We are, our Watch Coalition does collaborate with Help Me Grow North Texas, but all of you are a part of that collaboration if you live in Denton County or any of the other 17 counties in North Texas. Help Me Grow is a great opportunity for children 0 to 6 and their families. They can get free developmental screening. They can get connected with resources in the community. They talk to a real live navigator who makes a plan of action to help that family, mental health and other resources, anything that family needs. And that real person follows up with them in 2 weeks to see how that plan of action is going. So it's a wonderful resource, and you can find it at helpmegrownorthtexas.org. And I put the information almost every month in the Watch Coalition newsletter. But if you live here, you are a part of Help Me Grow North Texas. And if you want to know more about it, Kathy Houston is one of the staff members who works in that organization, collaboration. So it's great for kids with families with kids under 0 to 6. So.
Thank you so much, Maxine. That's an incredible resource. Would you mind, please, you or Kathy, putting your contact information or that website in the chat so we can make sure to capture that and get it out? Thank you. Yes, Help Me Grow, excellent example of connecting those dots across the community. Well, we have just a few minutes left here. Looks like about 3 minutes. So we'll ask our last question for us all. And that is, what other organization needs to be at the table to improve children's health in our community? So who else needs to be at the table? I'll invite you to put that in the chat. Yeah, Lauren.
I think we're all about to talk. Yeah. I was going to say, Elisa, I don't want to put you on the spot, but I know that you've, in some of our previous conversations, have had some really great ideas on maybe some folks who could, join Watch or be part of these conversations to help move that work forward.
Yeah, you caught me right as I was unmuting. That's actually an ongoing conversation as part of the membership committee within the Watch Coalition. And so I think we have a good mix of folks at the table, and that seems to be the consensus, but there's always more is welcome. And so I feel like more libraries, more religious institutions or spiritual institutions, different ISDs, more city representatives, more law enforcement, more parents, and some LGBTQ plus representation would be ideal. And so if you fit that category and you're interested in joining, feel free to reach out.
Absolutely. And I think at the very end, we're going to have a slide. We'll make sure you all have Elisa's information. So if you are interested in joining the Watch Coalition or Cook Children's efforts, we'd invite you there. Or as we've seen in the chat, if you see other groups across Denton County who are doing great work also, we would encourage you to join them as well. So with that, I'm going to thank you all for your participation and putting things in the chat. It's not too late until we stop the Zoom. So if you have other thoughts, put them in there so we capture them. And I'll turn it over to Lauren. Thank you.
Hey, thank you, Courtney, and thanks everyone. I think these discussions are always just so fun, and it's always such a good opportunity to learn more about what each other does in each community. So in the spirit of continuous improvement, we're going to pause. You'll see a QR code here on the screen, and I think there may even be a link provided in the chat here soon. But we'd like to ask you all to take this brief survey about today's event. We really take your feedback seriously, and it'll be used to help plan any future events that we host. So we're going to pause for just a few minutes to allow everyone to do that, and then we'll resume with our closing and call to action. Your support for not only Watch, but also the Center for Children's Health really plays an important role in improving the health of Denton County children each and every day. So you can find more information related to C4CH and the coalition and those data resources presented earlier on our webpage that's provided there on the slide. And then you can also contact Elisa Quimby if you want to know how to get involved with the coalition or just learn more about what they do. Her email is also listed there. And then we also talked about a data dashboard that was presented during today's presentation. And so it's also available to the public and contains some really great information related to children's health in our region and Denton County. And you can really dive into some more data there if you're curious. So if you have any questions about the presentation today, please email chnafeedback@cookchildrens.org. But thank you all again for spending your time with us today at our Denton County Health Summit. And we hope you all have a great afternoon.